But then we will go to a bit easier technique, screwdriver technique, it's called. It's like manip screwdriver. Now, you ask me how long the results last from manipulation. Nothing lasts forever, isn't it? Nothing. You know, even manual therapy or even exercise. If you stop exercising, you know, we're gonna lose it. So I think the key important thing, that's why I think, why this course I think really might be helpful is about clinical reasoning, assessment, understanding the problem. But then treatment, you've got lots of options.
Yeah.
So if one thing doesn't work, you try something else. But always complement with exercise, not only passive treatment.
Yeah.
But to be honest, for some people, you might need just to do one, and that's it, pain is gone and they're fine.
Mm-hmm.
For some people, as we know, we need more. So that's why we, again, keep assessing, reassessing, and then keep modifying according to your patient needs. Okay, so the screwdriver technique, I left it to the end because I think it's an easy one. The harder one was, you know, the pistol grip or that sort of manipulation. Now for a screwdriver, the same thing what we're gonna do. It's sort of like it's a PA pressure, so it can be mobilization, but also can become manipulation as well. So, so let's say if you got two levels, do you have a pen? Thank you. So if you've got, let's say, two levels, so again, this technique is more for the mid-thoracic spine. So ideally what you want to do is, we can either screwdriver rotate this way and apply PA pressure, or rotate that way, PA pressure. So if you go two levels, so one hand, let's say, gonna come on top, this one below, and then we're gonna twist the tissues, and then straighten out the elbows. And then from here, first of all, I just apply PA pressure. So you can mobilize this way. Okay, so you mobilize 45 seconds. What movement can improve this technique? Which movement? Extension for sure, isn't it? Because it's extension moment. So when you do PA, you create more extension. But when you manipulate, you can have non-specific effects. Also, you can improve rotation, can improve flexion, can improve extension as well. So a bit of a twist, elbow straight, and you see my hands are fairly relaxed. So fingers are relaxed. I'm using my body to create that PA pressure. And the force is coming from hypophyma through the big surface area. So much more comfortable that way. So you mobilize, but then for my nip, you can do breathe in, breathe out. As the patient breathes out, all the way down. All the way. Yeah, and then only then you quick. So again, it's one movement, not two. You know, sometimes I used to do as well. Well, not, you know, we're saying it, sometimes I do this, relax, and boom. And it's like, so it's really, at the end of that, when you do the screwdriver, patient breathes out. At the end of the expiration, when you feel at the end, it's one movement rather than two movements. Okay? So that's the key thing. But you also can do on that side and rotate that way. It doesn't really matter. But the key thing is just ulnar borders, twist, get a soft tissue slack, straighten out the elbows, and then just apply that PA pressure. Because you all had already cracked probably, so you're not going to crack today. So just do gentle sort of mobilization with that, okay? PA mobilization. Any questions, guys, on that?
Are you targeting at one level or both? Both. And then I see you twisting in a clockwise position. So will you do another direction?
If I stood on that side.
On that side.
It's just, you know, I think that rotational component is just getting that soft tissue slack out of the system. Otherwise, you're sort of sliding through the skin. So if I'm on this side, I maybe rotate that way. Because you could rotate that way as well, actually. In fact, on the side, I have it, you know, I just do automatically. So you could be doing this as well. So it's about maybe your comfort. You know, people can argue saying if you're rotating that way, that maybe improves the right rotation. And if you do that way, maybe that improves left rotation. You know, maybe, I don't know. I don't have that research to back myself up with that. So can't comment. But it's certainly what we're trying to do, panel effect. you know, already talked about many times when it happens. Okay, any guys have any questions on that? All right, let's try this one. Just gently mobilization. If you want, you can try to do it.